Today, we'll be learning about malaria. Here's what we'll cover in this lecture. The definition of malaria, what it is, the species of malaria, the causes of malaria, the risk factors associated with malaria, the life cycle of malaria, the symptoms of malaria, how to diagnose malaria, its treatment and prevention. Let's get started. What is malaria? Malaria occurs when a mosquito bites a person and injects a parasite called plasmodium into their body. This plasmodium travels through the bloodstream, damaging red blood cells, RBCs, and the liver. This is what causes malaria. Species of plasmodium. There are 5 species of plasmodium that cause malaria. Plasmodium falciparum. This is the most common and dangerous species. Plasmodium vivax. Plasmodium ovale. Plasmodium malaria. Plasmodium knowlesi. Epidemiology. Where does malaria occur? Malaria is found in specific regions around the world. Countries marked in green on the map are malaria-free, such as Canada, North Africa, Russia, Europe, and Australia. Countries marked in yellow are malaria-prone, including large parts of Africa and Asia. Globally, 400 million people are infected with malaria annually, leading to 2 million deaths each year. Risk factors for malaria. Certain factors increase the risk of getting malaria. Traveling to malaria-prone regions with a high mosquito population. Pregnancy, which makes women more vulnerable. Children under 5 years of age. People with HIV, AIDS who have weaker immune systems. What is the vector of malaria? A vector is an organism that carries and transmits a disease. For malaria, the vector is the female Anopheles mosquito. When this mosquito bites, it injects plasmodium into the human bloodstream via its saliva, starting the infection. The life cycle of malaria. The malaria parasite completes its life cycle in 2 hosts. Primary host, the mosquito. Secondary host, the human. Here's how it works. The mosquito bites a human, injecting plasmodium into the blood. Plasmodium travels to the liver and transforms into merozoites. The merozoites re-enter the bloodstream and attack red blood cells, RBCs. Inside RBCs, they form gametocytes that later become male and female gametes. These gametes are picked up by another mosquito when it bites the infected human. In the mosquito, the gametes fuse to form a zygote, which undergoes fertilization and meiosis. The zygote migrates to the mosquito's salivary glands, ready to infect the next human. This cycle continues, completing in both mosquito and human hosts. Incubation period of malaria. Let me tell you first, what is the incubation period? The incubation period is the time between infection and the appearance of symptoms. It varies by species. For Plasmodium falciparum, it is 7 to 14 days. For Plasmodium vivax, it is 12 to 17 days. For Plasmodium ovale, it is 9 to 18 days. For Plasmodium malariae, it is 13 to 40 days. Signs and symptoms of malaria. Common symptoms include high fever with chills, sweating and headaches, weight loss, dark urine. Jaundice, it is the yellowing of the skin and eyes. If these symptoms are present, malaria should be suspected. How is malaria diagnosed? To diagnose malaria, we take the following steps. Medical history. Check if the person has traveled to a malaria-prone area. Physical examination. Look for signs like hepatomegaly, enlarged liver, or splenomegaly, enlarged spleen. Laboratory tests. RDT, rapid diagnostic test. ELISA enzyme-linked immunosorbent assay, PCR polymerase chain reaction. These tests confirm the presence of malaria. How to prevent malaria? Here are some practical ways to prevent malaria. Use mosquito nets. Sleeping under a net prevents mosquito bites. Eliminate stagnant water. Mosquitoes breed in standing water. Removing it reduces their population. Apply insect repellents. Use them on exposed skin to repel mosquitoes. Wear protective clothing. Cover arms and legs with long-sleeved shirts and pants. Treatment of malaria. Treatment depends on the species of Plasmodium. For Plasmodium vivax, for Plasmodium ovale, for Plasmodium malariae, it is 13 to 40 days. A combination of chloroquine and primaquine is effective. For Plasmodium falciparum, if in chloroquine-resistant areas, use other medications like quinine, mefloquine, sulfadoxine, pyrimethamine. If in chloroquine-sensitive areas, use chloroquine. These treatments help manage and cure malaria. Question of the day: which mosquito spreads malaria? Only a genius can answer in the comments below.